Well, greetings again. This is Dr. Bill White with the American Orthodontics Society. And we've had a lot of people asking about retention and how, when you straighten somebody's teeth up, what is required to hold those teeth like that for the rest of their life, really, is what people want. But that's not what they're getting from the retention that most people are turned loose. They give them a retainer and they say, wear this for so many weeks and in so many days. There's no set amount of time you have to go to wear a retainer to hold the teeth in place. So I want to go through some stuff here and show you what actually happens. Just the first person I want to show you this is a lady with osteoporosis, and she came into my office in 1980, and we did records on her, but she decided not to start doing work for it. And I didn't see her again for 5 years, and she came in 1985, and we took some records again, and I want to show you the difference in the teeth. Somebody who had osteoporosis, a very little bone structure to support the teeth, and how the teeth move. So let's get started on this as much as we possibly can here. Let me touch this. I'll have to. All right, here is the lady in 1980, came in looking like this. And here it is in 1985. Now you can see the difference in here. Looking at the outside of the mouth, you don't see that very much. If you look at 80, that looks worse really than look at 85. But in 85, it was a lot worse. Here it is as 1980, and there it is in 80 again. That was the smile she had. And here it is in 85. You see the teeth closed down, and it changed the facial structure a lot. Here's and this is in 1990. That really, as she got older, she had to wear a retainer constantly the rest of her life. If she leave it out for just a matter of a week, I mean, the teeth would move, but she could get it back in place. And here it is in 1995, I think, something like that. All right, let me go through the models, and we've set up what we took in 1980, and you can see in 1985. Now the structure over here, as we see, I'll just have to stretch out over there. You can see where those teeth meet over here, and then you see where they meet here. This hadn't changed all that much back here. But look at the front part of the mouth up here, and then look at it over on the other side. I mean, the teeth are sticking out that much further than it was in 1980. Now, so there was something in there, the pressure in the mouth was pushing those teeth away, and they had no retention or anything else in there. Now let's go and look at 1980 again, looking at it from the front. Look where the teeth were lined up here. I mean, you see this, the bite was closed down here in 1980, but in 85 it really was closed down. I mean, you don't even see the bottom teeth over here. And you look at these teeth on this side of the mouth, there was some quirk in the muscle structure in this lady's mouth was pushing these teeth in. Maybe a vacuum, or maybe the way she slipped, something was happening, and you look and change these teeth in this area right in here, and you look where they were later on. They look good over in that part. Now, so this was taking place, but there was some force in this lady's mouth that was there. Nobody knows about this force. Maybe the way the lady slipped, or maybe she may have put her hand on his face when she was sleeping and pushed the teeth in. I don't know what it was, but there was something there. So nobody knows what's going to happen to their teeth. They straighten them up, and you have to watch what the person does to tell what you're going to have to do. And the bite closed down. You see where these teeth are right here, and you see where they were in 1980. So if you put a retainer in there, you're going to put a bite plate on it to keep it from deepening like this. Now let's go on to the next slide over here. The way the teeth were meeting back in the back part of the mouth, this is the left side of the mouth, is not a whole lot difference in this. This looks pretty good back in, let me get where my, over here. This is the way it looked back in 85, and it's not a lot worse than it was in 1980. But the front part of the teeth out here, like you see, this tooth is sticking out way over here, and over on the other side it's not near that far. This was in 1980, one of them was really out there just about the same distance. Now, something that this lady was doing, and she was very sensitive to this. When I got the lady in 1980, and she decided not to do the orthodontics, and then we came in and looked at it in 1985. I mean, it had gotten so much worse. Look up here at the anterior part of the mouth. And I said to myself, well, this is going to take me a long time to get this mouth straightened up and bring it back to, and actually we wanted to improve it. We would make it a lot wider out here as we did in this area right here too. So we'll show you the finished thing when we get here through here. 1985 and 1980, you see where the teeth were. You see this cuspid sticking out here. Look where it was in 1985. Look at the other areas. Like this got straighter across here, I guess, as the cuspid moved out here and let these teeth straighten over here. You see where this lateral is right out here close to the edge, and over here it's not. So this was more crowded. Now this straightened up from the tongue pressure and everything because this lateral moved. See where this one moved over here on the cuspid, where it was before, right here. Now, nobody knows what's going to happen to these teeth when you finish straightening them up. And it's so ridiculous to say, here, I'll give you a retainer, you wear it 3 months, and then you start sleeping in it or something, whatever it is. Nobody knows what you have to do until that person finds out what's going to happen. Some of the things we can put in a retainer to keep the bite from deepening and things like that. If they wear it, it'll stay that way pretty much. And some people, this lady had to wear the retainer for the rest of her life. Now, there's the lower teeth went up like this, right in this area. That's 1980. And I don't have another picture of that, but here's from the inside of the mouth. The teeth were up there in 1980. In 1985, they had gotten even worse back here. So I'm going to go back to, now this is, I thought it would take me 2.5 or 3 years to do this. We had this lady's teeth straight and fixed out in about 11 months, if I remember correctly. This is 1986, and the teeth are just about lined up. I've got a little problem down here. We had to clean this, keep that cleaned out, and get it to heal up. And there we put an intruding arch. You know, we brought these teeth down. They were way up like that, and lined it up. And we got it. We did this in about 11 months on an adult, and she's probably 60, 65 or something like that age. And there's the lower teeth lined up in 1986, and you saw where they were before. We got a nice looking curvature. Now here it is in 1985 when we started. This was down here, and now look where it is. We've opened that bite up. We then really keep this cleaned out down here at the bottom to hold that in place. These are crowns. You don't see them back in the back. Now we get over here, and here is 1985 and 1986. This is 11 months after we started the case. And it's lined up. We got a little food stuff in there. Just should have looked at that before we start. And the retainer. And by the way, somebody's asked about, we used to weld the retainer right here. Now we lay one wire here. This is 036 wire. This is 028 round wire. Don't use these flat wires. This round wire has less force on there. And that's the way we finished it in the case in 11 months. And here you see where the teeth were over to the left side over here. They stick it out here. These teeth were turned back in there, and now they're sticking out straight. We changed the whole torque and everything in those teeth. And that happened. Now this lady bite deepened. In other words, she went way up underneath. I showed you that inside the lower teeth were up in the roof of the mouth. We opened that up. So we put a bite plate on your retainer. I knew it was going to try to close back down again if we left that where that didn't touch. So look at the way the teeth are lined up here and the way they're here. Now, when this lady got out and she knew this was going to happen, if she left this retainer out for 2 days, it'd be hard to get back in. The teeth move so quick like that. And that's the way you have to figure out what the person's going to do. Look at the width of this jaw now, and then look at how this was going this way. We widened the whole jaw out. And so if she left this retainer out, the force in here to push these in would go in and cave that thing in a matter of 2 or 3 months. You couldn't even get the retainer back in her mouth. So this is a thing that I want people to understand. If we take somebody in and they're protrusive, they're a real full-faced person, and they want to have the facial structure in some, then we remove some teeth up here in the front part of the mouth, the bicuspid, first bicuspid, and we bring that back in, and then we make the person look more like they want to look. Now, when you do that, you also have an effect on the pressure, the inside pressure, the tongue going out and moving against that moves the teeth to a certain point. And the cheeks and here, the way the person pulls their teeth and everything, they have a certain amount of force on the outside and a certain amount on the inside, and the teeth are going to go to that neutral zone, somewhere in between. And nobody under God's heaven knows where that is exactly. I mean, you can get all the symptometric stuff you want to do it. It's not going to tell you where those teeth have to be. So you make retention that'll hold them there. Now, if this person is pressing harder on the inside than on the outside, they're going to have to stay with that retainer really good until it'll finally move the whole upper and lower teeth forward to a point where the pressure out here is the same as the pressure on the inside of the mouth. And God knows, nobody knows exactly where that's going to be. So you have to stay with your retainer that long. Now, there are people, I think was a movie star, Loretta Young, a beautiful lady. I think she was wearing a retainer when she was 60 years old in movies because she had a real protrusive smile, and she had to wear this retainer at night, sleep in it, or do a certain amount to hold those teeth in that position. And finally, the jaw make it, push it to a certain point where it's still lined up and looking good, but it can be out forward or back a little bit. And you have to stay with a retention like that. So this is retaining teeth. There is nobody anywhere can tell you just wear them so much and then hope that it stay the same. They're not going to do it. You straighten them up. And if you've got a deep bite person, if you don't put some kind of deep bite retention up here, put a bite plate under, they'll, so help me, they will deepen regardless what. If they do, sometimes they deepen, they push the jaw back, and you can develop a TMJ problem from the way you retain the teeth. So I'm going to quit and shut up here, and I hope you will join our group and subscribe to this, and I'm going to try to get the message across of real good orthodontics and how you keep orthodontics the rest of your life. You know, some people are going to have to wear retention, they'll have to sleep in it or do something the rest of their life. There are other people who can wear it just a short time and it'll go. In other words, if you let somebody, if you correct it, let the tongue and the lips tell you where they're going, and they put them out here and they're straight, they don't have to wear retention very much at all. I mean, they'll stay that way. Okay, so I'm going to sign off here and hope you get something out of this. So I'll stop it.